So nobody else in my family was in medicine. For me, it was when I was younger, my grandfather, who kind of helped raise me, had cancer, so he was in and out of the hospital a lot. And that's sort of what was my tipping point to want to go into medicine. When I was around 8, 9 years old, I kind of decided I wanted to be like his doctor who was treating him. And I wrote this little sign that said Dr. Karim, and I had it in my little, those little Fisher Price desks. And then my mom saw it and she just taped it on my door. After that, that's sort of when I just knew that I was just going to go into medicine. I kind of had a one-track mind and stuck to it, and luckily I made it through because I have no idea what I would have done otherwise. It used to be, if you have a heart attack, you can only have an open heart surgery. The field that I train in now, I can do things, I can open up heart blockages through a 2mm puncture in somebody's wrist or in somebody's leg, and they go home the next day from a heart attack. I look at it as this cutting edge thing where you can have a big impact through what is literally a little tiny, tiny hole. Like most interventional cardiologists, I treat heart blockages, chest pain, heart failure, arrhythmias. I also treat blood clots, both in the legs as well as in the lungs. And I treat peripheral artery disease, meaning people with wounds in their legs that don't heal due to blockages in the legs. I treat those. And I treat heart valves. So people who have blocked off heart valves or heart valves that need to get replaced, I can do that through the minimally invasive thing. I do a lot of high risk and complex coronary artery work, which means patients who are very high risk for surgery or deemed high risk by another cardiologist for a stent procedure. I typically work, with industry and other things to find an option for them. I've seen medicine kind of go all sorts of the spectrum of, we went from anytime we see something, we feel like we have to do it. And then there's also the other end where people just say, hey, I'm going to do nothing. And I think there's a lot of medium in between. Part of that involves talking to your patient, getting to know them. I always try to spend a good amount of time getting to know what matters to my patients and then try to put myself in that mindset. If it was my family member, if it was my dad, what would he want?